Crystal. My name is Erica Sequis, and I'm going to be the nurse practitioner doing your head and neck assessment today. How are you?
Good, how are you?
Good.
Nice to meet you.
Nice to meet you too. So is it okay if I do your assessment?
Yeah.
Okay, so I'm first just going to be looking at your head and looking for any abnormalities. And just looking at your size and shape. Everything looks just fine. I'm going to feel your hair and look at your scalp a little bit. Have you had any problems with your scalp, any dryness or itching?
Nope.
Okay. Now I'm just going to feel your head and palpate it. I'm feeling for any lumps or bumps or abnormalities. Any pain or tenderness anywhere?
No.
Okay. And I'm just going to check your temporal pulses and your temporomandibular joint. Can you open and close your mouth for me? Thank you. One more time. That feels really good. Do you have any pain or cracking or popping with that ever?
No.
Okay. I'm going to check your sinuses. Any pain or pressure?
No.
Okay, good. Okay, Crystal, now I'm going to check your eyes and do your eye exam. First, I'm just going to start with inspection and just make sure that everything looks okay. No signs of crusting on your eyebrows or eyelashes, no redness. Now I'm going to check your sclera. They look nice and white, and I'm going to pull down just a little bit further and look at your conjunctiva, and it looks nice and pink. Looks totally normal. Okay, now I'm just going to check your eyes. Can you look straight ahead? I'm going to check for foreign bodies, for any color differences or anything that's not symmetrical. Everything looks good. I'm going to check your pupil reflex, so if you can just look straight ahead. Okay. And now I'm going to check your pupils for reactiveness. So just go ahead and look straight ahead. Don't look directly at the light, just look straight ahead. Good. Okay. Okay, great. Okay, Crystal, now we're going to go ahead and I'm going to have you do some tests to check your vision. This first one's going to check for visual acuity, so if you could go ahead and take this card and start with your right eye, so cover your left. And then looking at the Snellen chart that's on the wall, would you please read the lowest line that you can read clearly?
F-E-L-O-P-Z-D.
Okay, good. Would you mind switching to your other side and then reading the lowest line you can see with that eye?
E-D-F-C-D-P.
Okay, good. Thank you. Can you go ahead and have a seat back on the bed for me? Now I'm going to check your peripheral vision. I'm going to have to get a little bit close to you. This is called confrontational test. And so what I'm going to do is I'm going to put my arms over your shoulders, and I want you to tell me when you see my fingers moving. And just look straight ahead. Look into my eyes.
No.
Okay?
No. No.
Okay, good. Okay, this test is going to test your eye muscles. So if you'll just watch my finger and just don't move your head, just watch my finger and follow it with your eyes, okay? Okay, and then just follow my finger all the way into your nose if you can. Okay, great. Crystal, now I'm going to check your eyes with the light. It's called the fundoscopic exam, and I'm going to actually get a little bit close to you, and I'm going to look all the way back into your eyes. So if you can just look straight ahead, that would be great. So right now I'm looking for what's called the red reflex. Okay, good. And now I'll do your other eye. I'm just going to have to adjust this a little bit. Okay. All right, great, thank you. Okay, Crystal, now I'm going to be looking at your ears. And again, I'm going to start with inspection and just look at both of them. Make sure everything looks normal. I don't see any signs of drainage or infection. Does this hurt at all? Okay.
No.
Okay, I'm going to check your hearing now. The first test I'm going to do is called the whisper test. So I'm going to go ahead and plug this ear, and I'm going to say a word, and then I want you to say the word if you can hear what I say. Okay?
Baseball.
Okay, good.
99.
Perfect. Okay, this is also a test for hearing. I'm going to place this right back here behind your ear. I want you to tell me when you stop hearing it, okay?
Okay.
Can you hear that?
Yep.
Okay, good. And let's do the other side.
Okay.
Can you hear that?
Mhm.
Okay, this is the last test I'm going to do to check your hearing. It's called the Weaver test. And so I'm going to place this on your head, and I want you to tell me if you hear this better in the right ear, the left ear, or both.
Both.
Okay, great. Okay, all right, I'm going to check your ears now. I'm going to look inside of them with a light. Okay, I'm just checking for any discharge, redness, swelling. Okay. Okay, now Crystal, I'm going to go ahead and take a look at your nose, and I'm just going to inspect it, look for any abnormalities. Can you go ahead and just occlude one of your nares for me? And can you sniff through it? Good. And how about the other one now? Okay, great. I'm going to take a look inside. I'm going to make sure that the mucosa looks nice and pink. Okay. Great. All right, Crystal, now I'm going to check your mouth and your throat. Right now I'm just looking at your lips. I don't see any lesions or any problems with them. Can you go ahead and open your mouth for me? Just grab my light. Okay, can you say ah? Okay, great. I'm going to go ahead and just use this tongue depressor so I can see the back of your throat a little bit better. Okay, go ahead and say ah. And right now I'm just looking at your tonsils, your pillars, and your uvula, which is midline. Sorry. And you have good dentition. Okay, can you lift your tongue up for me? All right, great. Okay, the last thing I'm going to do is just check your neck. So I'm going to look at it, and I'm just making sure that I don't see any masses or lesions. Everything looks straight and normal. Trachea looks midline. Okay, I'm going to palpate your lymph nodes. Okay, starting here, in the preauricular, and moving to the postauricular, the tonsillar. Okay, and then the anterior cervical. And the posterior cervical. And then the subclavicular.
Oops.
Okay, and then the occipital. Okay, now I need to just fill your trachea, make sure that it's midline. And that looks good. And then now I'm going to check your thyroid gland. If you could just turn sideways a little bit, I'm going to come from behind you, and I'm just going to find your thyroid here. Okay, and then if you could just go ahead and swallow for me. Okay, and one more time. Okay, thank you. And then the last thing that I need to do, if you can just turn straight, I'm just going to listen to your thyroid gland and make sure that I don't hear any bruits or abnormal sounds. Okay, and thank you so much, Crystal, for being my patient today.
You're welcome.